Mr. Mabelebele, good morning to you. There's quite a lot that I see on your media statement that you're raising. I think if I can get to the point of just what it's costing to become a nurse in this country, an essential service long before COVID, even more so importantly now, why is Denosa, the student movement, saying you're concerned about the financing of nursing education? What exactly is the problem?
Well, the concern is that there is no certainty in terms of where we are with the funding model, because if you check, 4 years ago, the whole country started migrating to a bursary system from a PESAL system. So 2 years or 3 years down the line, after introducing the bursary system, it was then taken away by other provinces, so meaning that the nursing students had no funding from the Department of Health anymore. And we started taking the National Student Financial Aid Scheme as an alternative to funding nursing education, which actually does not accommodate all nursing students. So you must understand that nursing as a cause itself, it requires you to be in the field to practice your skills. So there's no, when you are using a funding like NSFAS, you really do not have enough to actually buy you uniform, to actually get you to, get you transport to get your practical areas, the hospitals and the clinics. So when we wrote, when we responded to the statement, we were actually saying it is good that at least the funding will not be taken away from nursing, but we need to then review the funding model of nursing education itself and go back to the PESAL system where you will actually get things like the medical aid subsidized, so that you know that when you are in the workplace and anything happens to you, then you are able to actually be covered. You would get things like pension funds, you'd get paid for working on holidays and weekends. You would actually get your pay progressions, and so that in itself was addressing youth employment in South Africa, and it was a good strategy to actually get people interested into coming into this profession, which is we're in need of it at the current moment in the country.
We really are, and I was actually so glad you raised the point right towards the end where you're saying that it was encouraging young South Africans to want to go into the healthcare professions and also that being of nursing. Do you think, Mr. Mabelebele, that by having the funding changing, not taken away, I think we must be clear on that. It's not that there's no funding, it's different funding, which is now supporting different elements of education for nursing. Do you think this is going to deter young South Africans from wanting to go into the nursing field, which, as I said before COVID, was paramount, and during COVID is essential to saving lives? Is this going to deter young South Africans?
Well, it is already happening, because if you check, ever since the introduction of this new bursary system, you have a decrease in the intake. More especially in universities. Universities went from taking 60, 70 students to now 30 students per year. So meaning that they were producing less nurses in universities. At least colleges are benefiting because the funding is still there, but not as effective as it was before. Now, even if you come into the profession, the person who's inside will not inspire you to come inside again, because they will tell you about the nights of hunger, or going into the ward in the morning without any food, or having one meal per day. And you are working in an environment that has a lot of microorganisms around. You are easily affected if you are not actually getting enough nutrition.
Mr. Mabelebele, I'm sorry to interrupt, because you're absolutely right. Trying to survive on one meal a day for anybody is difficult. I can't imagine for a nurse who's working incredibly long hours. But before I let you go, in my final question to you, what are you hoping to do? Who are you hoping to hear from to try and get these grievances heard? In the last final brief answer from you, please.
Okay. So the Department of Higher Education and the Department of Health, because we believe that as much as nursing education is transitioning to higher education at the moment, the Department of Health must not actually just take the nurse into higher education without actually solving this matter of the funding model of nursing education. Point of departure is that we must go back to the initial system of funding, which was effective and it was never supposed to be taken away in the first place.
And I appreciate your time in speaking to us and also giving us clarity on your concerns and what you are hoping to achieve out of this. From Denosa, the student organization of Denosa, Mr. Nathaniel Mabelebele joining us here in South Africa. The cost of nursing just to get an education is changing, and the funding is changing, which is causing major knock-on effects for the young nurses coming through the system.